At least the most difficult thing is in our everyday practice to evaluate for each patient what will be clearly the benefit of the chemotherapy. We know regarding the different trials, the meta-analysis, that in general chemotherapy will benefit to the majority of the patient if we look at the overall survival and all the population groups. But probably that there is actually more than 1/3 of the patients that clearly do not benefit from this chemotherapy because they have, let's say, good prognostic factor and also very low predictiveness of impact of the adjuvant chemotherapy. They don't need chemotherapy. So individually, even if we discuss a lot about personalized medicine, it's pretty difficult to have this kind of approach, actually. We have a general statement, a general vision of is it necessary or not to take this kind of treatment to help them, but clearly say to the patient, I'm 100% sure that this will benefit. To be honest, I could not say. We have actually several tests that we might use to evaluate the prognosis of the disease, and I have to say that looking at the prognosis, it seemed that the tests are really pretty equivalent concerning this point. But the most important parameter is the predictiveness of the impact of the chemotherapy, and then I think that from my point of view as a clinician and as an oncologist that might decide if the patient needs chemotherapy, prognosis is one thing, but the impact of the chemotherapy and the predictiveness of the chemotherapy is very important. So regarding this point, we don't have very high level of evidence in a lot of tests. The only one I know with clear, interesting parameters are the Oncotype DX test, giving us this information not only prognostic, but also predictive regarding the impact of the chemotherapy.